Hi guys, we got another one today from one of our followers that requested this. It's CIDP, or chronic inflammatory demyelinating polyneuropathy, hence why it's called CIDP. It involves nerve swelling and irritation, and it's due to inflammation that leads to the loss of strength and sensation. It's caused by an abnormal immune response. So it's an autoimmune disorder that attacks the myelin cover of the nerve. And because of this, when that cover is attacked, the nerve becomes inflamed and irritated, and things go awry downstream from that nerve. It is actually the chronic form of Guillain-Barré syndrome. It can be chronic. It can be episodic, like gout, get it here and there. It depends a lot on lack of activity and stress as far as the episodes. If you're really stressed out, or you're not eating correctly, or if you have an infection, you can see you'd be more prone to have another attack of it. But there are patients that will have complete recovery, so that was a good thing with this one. It may occur. It's most likely going to occur in patients that have other conditions as well, such as HIV, hepatitis, diabetes, irritable bowel syndrome, cancer, lupus, hyperthyroidism. It can be a side effect of cancer treatments. It can also be a side effect of HIV medications. And if you've ever been infected with Clostridium jejuni, you're going to be more prone to getting CIDP. It's more commonly seen in men than in women, but it can be seen really at any adult age, okay? Symptoms that you will see, first off, you're going to have trouble walking. This is due to a couple of things. Number one is the weakness in your legs and feet. Secondly, it's because of lack of sensation in your legs, feet, and toes, because you can see tingling, prickling, numbness in both the fingers and toes. So when you go to walk, you may not exactly feel where you're at, and you have trouble with that. You can also see trouble using your arms and your legs in general activities that you're doing. Okay? If it becomes severe, you can actually have trouble breathing as well. You will see some fatigue with it, and some of the weird things that you could see with it, not everybody does, but some do, and that would be a change in your voice, kind of like going through puberty. You're going to see that change in your voice and hoarseness. Be aware though, a lot of these symptoms are common with other things that you can go through. Change in your voice, hoarseness can be to allergies. You can have the cold or the flu and see that. Fatigue is basically everything. Weakness can basically be with everything. So you want to really look at your history and go through and see that you have these other things lining up. For treatment, the goal is total reversal. I was so glad to see this with this disease, because I thought we were going to go down a trail that had not very good outcomes. But the goal is total reversal. Because it's an autoimmune response, attacking the nerve, what they generally will treat it with can be steroids, and then not only that, depending on the severity, sometimes they may not do any treatment at all. But if you are in a more severe situation, if you're having trouble breathing, if you're having trouble walking or doing things you need to do for your job, they will of course do steroids plus DMARDs, DMARDs, which are disease-modifying anti-rheumatic drugs or immunosuppressants. So things like Imuran is one of them that they could look at and use with that. They may consider methotrexate with that. Remember, if you're on methotrexate, you need to be on folic acid as well. Something a little more severe, but as you progress, they would want to do this, would be injectable intravenous immunoglobulin. They may also do plasma exchange, where they'll switch your plasma out with maybe a family member, somebody else that has got the same kind of plasma, to remove, or they could use yours as well and filter it to remove the antibodies that is in the plasma causing the immune reaction. Good news here is 90% of the patients that get the disease improve with treatments, and you can have total improvement where you don't even see it again. However, 50% of all patients that do improve do have relapses. So it could be something where, like with gout, where you have a relapse and you have it again, you need to take your steroids or your DMARDs when you have an episode. They may put you on a DMARD on a low dose after it's gone away to prevent it from coming back. They may put you on a low dose on a daily basis. The prognosis is good, and with this disease you should have the same life expectancy as anybody else. So that's another positive with this. But if you find that some of these things are fitting into your profile, make an appointment, get in and get it checked out.